My name is Dr. Stephen Neudorf. I'm the medical director of the Blood and Marrow Transplant program at CHOC Children's Hospital. I'm here to talk to you today about transplant. So a child might need a bone marrow transplant for several reasons. Some patients have genetic diseases. That disease can be corrected by replacement of defective bone marrow with bone marrow from a healthy donor, and that's indeed the case. Other patients have cancers that keep coming back, and this is a way to give higher doses of chemotherapy to patients to help get rid of cancer cells. The other thing that a bone marrow transplant can do is actually the donor cells can actually attack cancer cells within the patient. And so the transplant accomplishes two things. One, it allows us to use higher doses of chemotherapy. And two, it provides cells of a new immune system that may attack cancer. And together, we think these are helpful in curing kids. Well, blood and bone marrow transplant it's a complex procedure. It involves making sure the patient is a good candidate for it, and we make sure that the organs are functioning well. We also make sure that the disease is under good enough control that we think the transplant will work. And then there's the issues of how do you find a perfect donor. Fortunately, we are coming into an era where we can use parents as donors, and we're having excellent results with that. So actually the donor searching is becoming easier. So once you've made sure that the patient is in good shape and you've identified a good donor, the patient receives the chemotherapy with or without radiation therapy, and then after that's completed, the donor undergoes either bone marrow collection, which is done while they're asleep in the operating room, or collecting of blood cells from the blood, and both are given intravenously like a blood transfusion. So blood and bone marrow transplants really need to be done at a center that has expertise in taking care of sick children. My role is actually relatively small. I help plan the transplant and supervise it, but it's the nurses, pharmacists, child life, social workers, and all the medical consultants that actually make the process work. And that's what we need. It's a team approach to getting patients through the whole procedure.